Well, we're here with Dr. Theocharides again. Hi, Dr. Theocharides. How are you?
Hi, how are you doing?
Good. Dr. Theocharides, let me ask you about wrinkles, removing wrinkles, and or tightening skin. You know, we hear sometimes in advertisements, skin tightening, we hear wrinkle removing. Is that one and the same thing? And what I would want you to explain, it just in case it's a different thing, it's the removing of wrinkles. You know, people are concerned about wrinkles. You know, tell us, please.
Sure. Well, you know, there are different procedures, and really, if someone wants skin tightening, which is kind of to help elevate the face, you know, we have the 3 Ds of aging. We have descent, we have deterioration, we have deflation. When we have a dropping, there are lasers that could actually heat deep in below the skin to actually cause some collagen stimulation and lifting, because the collagen kind of contracts. On the other hand, when we're talking about wrinkles, which are more superficial, it usually takes a laser that does a little more drilling or a removing of those wrinkles in order to work. So it's actually 2 different areas of the skin and 2 different kind of devices to do the job.
I see. So tell us a little bit about the wrinkles in this case, and we're going to have you later talking about tightening skin. So tell us about wrinkles.
We know as we age, we lose collagen, we lose that connective tissue, and the skin tends to lose that elasticity, and wrinkles develop. The reason why I'm so excited to be alive this time, we have such new technologies to really be able to remove wrinkles, lessen wrinkles very dramatically with really minimal downtime, minimal recovery.
Okay. How is that done? Creams or cutting the face, or what are we talking about here?
Well, if we go back 15, 20 years ago, there was a gold standard which was called CO2 resurfacing. We took off the epidermis and the dermis. That was done under general anesthesia. Patients looked definitely at least 10 years younger. The problem was they would have perhaps 3 weeks of an oozing, painful recovery and probably 3 months or more of redness. The latest technologies now involve doing what's called...
Let me interrupt you. You said you
Sure.
take off 2 things, both of them which I had no clue what they are. Can you repeat them
Yes.
in a way I understand it?
Sure. We have 2 layers of the skin, the epidermis,
Okay.
and then the dermis.
Uh-huh.
And when you do complete resurfacing, you're removing the entire epidermis and part of the dermis. The problem with that is when you remove the whole area, there's a huge recovery, and of course it required general anesthesia, which most people are never really excited to have to undergo. The beauty of the latest technologies, we give a local anesthetic cream on the face, we let it sit for about 45 minutes to an hour, and then we do what's called fractional resurfacing. Imagine an area of the skin, instead of removing the whole area, you do microscopic little holes, drilling, and what happens, because you have normal skin surrounding that, the healing is faster, is measured in days, not weeks, and yet you're still getting the collagen stimulation and the wrinkle reduction, and things like acne scars are dramatically improved with 1 or 2 treatments in a procedure that takes local anesthesia and just a few days of downtime.
So when you do say drilling, you really mean drilling in it, because otherwise you wouldn't have to give the person the local anesthesia, I guess, right?
Right. In order to really remove wrinkles, and particularly like acne scars, you've got to get right down to the depth of the scar, and that is, several hundred microns, which is, tenths of a millimeter, which is a very small amount. But the point is, you've got to get that deep to remove the scar tissue and to stimulate new, fresh collagen.
I see. So instead of kind of grinding down a whole big part of a face, you just do little tiny dots, lots of them, I suppose.
Think of a lawn. If you took a lawn and you aerated it, you have these small holes, versus taking a coffee can and making holes to coffee can. Coffee can holes take longer for recovery versus smaller holes. The smaller the holes, the quicker the recovery. And with the latest technologies, you can dial in the amount of energy, the amount of percentage of actual surface that's treated. So if a person only can afford to take a weekend of recovery, we dial in a milder treatment. It may take more treatments to get the job done, but we can tailor it depending on the amount of time the patient can take away. And when I say downtime, it's not really downtime like you're in bed, totally, not functional. We call it no social time, which means you really don't want anybody to see you except those that are close to you, because you have to have this cream on. It's like a Vaseline, and you look like you've had a bad sunburn for a few days.
Okay, I see. So, okay, I got it. You don't want people to see it, and most people don't want anybody to tell them they just had a wrinkle operation. You understand? I mean, that's the Hollywood joke, I mean, who is his plastic surgeon, right? We want to avoid that.
Right.
So that's why people like you probably, I don't know whether you do get referrals, I'm sure you do, but to a certain degree, who wants to refer you, right? I mean, nobody wants to tell his neighbor that he took your service. They want to pretend they look like that ever since they're born, right?
Well, they go through a few days of recovery, but the benefits last for years. Beautiful. It's not like other treatment that lasts for a few months and you need another dose of treatment. This effect does last for years. Think of this, our collagen level is dropping as we get older, year by year. When you stimulate new collagen, you take it up a notch, and then again we're obviously going down, but it's a slow collagen loss year by year.
And by doing this, let's call it drilling holes into the skin, the collagen gets basically generated naturally. It's almost like if you take blood out of a person, blood gets regenerated naturally. In fact, it's a good way to do chelation therapy, to clean your blood by donating a lot. Is that a similar effect with the production of collagen, or is it a chemical you give it with vitamins, with creams, or so? Which way is it, or is it both?
Is the primary method is by stimulating your own fibroblasts to stimulate new, fresh, virgin collagen. On the other hand, if someone is investing time and energy in doing these beautifying procedures, you definitely want to continue and have everything working the same. You want to be on a good skin regimen. We have medical grade skincare products that complement our services to help maintain. I'll give you an example. A person gets a photofacial treatment to help brown spots, but then goes out in the sun and doesn't use proper sunblock. Well, you pay for a treatment, and then you undo the benefits by getting excess sun exposure. So we want to make sure that everything works together and has a synergetic effect to optimize the whole process.
Got it. Now, one last question here. Those wrinkles, are we good with big falling wrinkles coming down here, or the frown wrinkles here, or is it, whatever? Does what you do work all over the face, or just on some parts of the face?
Well, the finer wrinkles, those wrinkles, like if I squint and you see these fine lines, those lines will be improved with the laser. But when we see like a fold like this, if I kind of move this and create a fold here, well, that fold is not going to get filled by a laser doing resurfacing, because that's more than skin deep. That's a whole level of loss or shifting. Those things are improved with fillers. Fat is becoming a very popular filler. We take a patient's own fat from one area and place it in their face, for example. One classic example, and this is the benefits of being part of the national organizations. I just returned from Phoenix from the American Academy of Cosmetic Surgery National Conference, annual conference. And, in the past, surgeons we were all guilty of, when a face is dropped, what do? We kind of pull it back. But it's not only a dropping of the face, it's also in loss of volume. So a face is deflated. If you simply pull it back, it looks gaunt. What we have to do is look at a person's face, study them, study what they're desiring to achieve, study their characteristics, and see, guess what? This person not only has some droop, but also has some volume loss. We have to restore the volume, we have to elevate, and in skin texture changes such as the browns, the red, we call them dyschromias, the fine vessels, we treat that with different lasers and other light therapies. So it's a combined effort depending on what the problem is, but usually it's not one particular thing that everybody needs. We kind of tailor depending on what's going on for the best result.
Well, all right. So basically, most small wrinkles and stuff, you have a method where you can remove them. The person doesn't look bad for weeks and weeks afterwards, maybe a couple of days, and on we go. Thank you.
Yes, you're welcome. Pleasure.